My name is John Dimar. I'm from Louisville, Kentucky. I'm here to talk to you today about the diagnosis of scoliosis, idiopathic scoliosis in young children. We probably screen most of our children either by the school mechanism, if that's available, or, of course, by your pediatrician or medical doctor. Particularly, we recommend 2 screenings between the ages of 10 and 14 because the curves can be very subtle to pick up. It's important to consider this if you have a family history of scoliosis, either in the mother or father or other members of the family, because it is somewhat hereditary, we think, and it does get passed down from parents to children. So that's why we recommend screening and identification of it early, because the earlier we find it, the better and quicker the treatment can be instituted, and the less chance of the curve getting worse as the child grows. And we have a very limited period of time to do, for example, bracing between the ages of probably 9 and 14, because once you get to be skeleton mature, the curve's probably much larger and will be fixed, and bracing will be ineffective. So we like to diagnose this very early, and that's what the purpose of our discussion here today will be, actually showing you a very simple physical exam that you can do on your own children to quickly identify whether or not they have curvature. A few things that you want to look for in your children is asymmetry of the head, or unlevel shoulders, or the flank creases not being level, or perhaps one hip sticking out, or, for example, the hemline on the pants or dress not being equal. That would be indicating the fact that there may in fact be, it looks like one leg being shorter, but actually it may be due to the curvature in the spine. And the curves can occur anywhere from the top of the spine, where you may get prominence of the shoulder blade or scapula, or just in the lumbar spine, where they're much more difficult to detect. And so we recommend that you keep an eye on your children, because frequently after the age of 10, in girls' cases in particular, they'll kind of disappear from your view for about 4 or 5 years because of body changes and maturing, and you may not even see the child progress the curve over that entire period of time. So we think that examining your children and understanding the basic signs of the deformity is very important. You can see that her shoulder's a little bit down on this side when compared to this side. She's a little bit more scalloped here on her side here and straight here. Her pelvis is very level. And when we turn her around, look at her back, straight ahead there, feet together, all right. And she stands nice and straight. She's got good lordosis, but you can see that her right shoulder blade here is somewhat prominent, and you can see her shoulders are not quite symmetrical. And again, you can see on the flank here a little bit more roundness, while here it's nice and straight. Her pelvis is very level. Now we're going to bend Clara forward. Can you touch your toes? Forward touch. And now when you look at her, you can now see that she's got a very prominence on here, and this really represents the ribs which are attached to the spine, because she has a very early scoliosis developing here. We also have a special instrument that we can use called a scoliometer that will basically, we can run up and down the spine, and it's really just basically almost like a plumber's level, and it will really show us whether or not she's got any significant scoliosis. So when we lay it right on the top of the curve, it's more than 7 degrees here. So she's developing an early scoliosis, okay? Now we're going to do a few other things here real quickly. We always check range of motion. We bend backwards. I always like to bend the side to side, because this tells me how flexible the curve is just by visual inspection. We can go the other way. Okay, can you touch your toes all the way down? We'll check her flexibility. You can go all the way down. That's good. All right. We always like to look also to make sure there's no skin pigmentation that sometimes can be indicative of some other underlying skin problems. And we've already done a thorough, turn around. We've already done a real good exam on her, and we know that all of her nerves and her reflexes and the things that make her work are all intact. So we don't really have to worry at this point about some underlying neurological problem. This appears just to be a family-based adolescent idiopathic scoliosis, because we've already talked to the father, who's off camera here, who has told us that not only does he have scoliosis, but his side of the family has scoliosis. So it's important to realize that it's more common in girls. It does run in families because there's some genetic component to it. And as we said earlier, it's very important to start treatment as soon as we can, because we do have very good evidence that bracing is effective and will keep the children from necessarily needing surgery, and in many cases about 75% of the time. We have a few other things that we'll talk about in the diagnosis of scoliosis. It's a multifactorial, or many things we look at basically to make the decision about whether or not there's scoliosis. For example, besides the history that we showed you in the physical exam, there's also some other diagnostic things we might do to establish whether or not you have scoliosis. And the most important thing we would do, of course, would be to take a very special X-ray that really needs to be taken by a spine expert, that is a picture of the entire spine, basically from the bottom of your skull down to your hip joints, so that we can see the entire alignment of the spine, not only in the forward-facing view, but also from the side, because it will tell us about the entire sagittal and coronal, as we call it, front and back, and side view visualization of your spine, so we can check for all kinds of deformities and the degree that deformities are at the point we see you. It's generally believed that less than 5% of curves will improve by themselves. So once you go over the 20-degree threshold that we mentioned earlier, and Clara, for example, in fact, on her scoliometer had about an 8-degree measurement, which is certainly a curve that's more than 20 degrees, which is getting into the brace treatment range. Very few of them, once they get over 20 degrees, will spontaneously regress. And no exercise that we know about will make them go back to a straight spine. Chiropractic care will not do that. Or a lot of other claimed modalities have never been shown in scientific studies to really reverse the curve and make your spine straight again. Well, our current recommendations are that we check your scoliosis usually every 4 months, and that can either be with a clinical exam or potentially with an X-ray, depending on how rapidly your curve has progressed and the amount of growth you have and the level of maturity, because these curves tend to get bigger while you go through your adolescent growth phase. So this is the critical time that we really need to watch your curve, is during that growth phase from, in certain girls, 10 and certainly as old as 14 to 15. In boys, it'll be a little bit later in that they generally follow girls as far as maturity, maybe a year and a half to 2 years later. So we would follow them to age 16 or even potentially 18 because they grow slower and longer. We try to minimize the number of X-rays because all X-rays in some fashion can be potentially harmful, but in the proper dose over the proper amount of time, they are of very little risk. There are many things we can do when we take the X-rays. Generally, we will take them from the back. We call that a PA X-ray, posterior to anterior. That will basically put very critical structures such as breast tissue or thyroid gland on the other side of the X-ray beam, which will be much more safe. We will try to minimize the number of X-rays we take by, for example, doing clinical exams or stretching the exam periods out. It's generally 4 to 6 months. We will keep examining you until you reach skeletal maturity. So we take great effort to try to reduce the radiation to a significant minimum. We have new X-ray machines now called digital X-ray that lower the dose compared to traditional X-rays a couple of decades ago rather significantly, and these have all basically been efforts to decrease the potential radiation exposure over the duration of treatment.